Now we'll look at the next type of fractures which we'll get to discuss and make some meanings out of them. So this is what is known as the acetabular fractures. So acetabular fractures is simple. If you know what is the acetabulum, of course, a very important part of the hip joint. So if you're having a fracture there, of course, one of the effects is you have a hip joint that is not stable. So there are just breaks in the socket portion of the hip joint, and this is where the head of the femur should fit in a normal hip joint. Okay, so these injuries are relatively uncommon, but they can be serious when they occur. So the acetabulum is part of the pelvis, and it forms a cup, and this is where the femoral head will now fit. You understand? So it's usually caused by motor accident. Maybe you fall from a high place, maybe direct trauma. Maybe in elderly people, their bone density is low. Do you understand that kind of thing? So they are complex fractures because the acetabulum is deep, is surrounded by vital tissue structures. Okay. So types of acetabular fractures: we have the anterior wall or column fractures, we have the posterior wall or column fractures, we have the transverse fractures. You could actually see them here, different types. Okay, different types. Anterior wall, transverse wall, posterior wall, all of them are here. Just pause to observe. Okay. So symptoms in general: there's a lot of pelvic pain or hip pain, inability to bear weight, possible deformity, of course it will affect the hip joint, and sometimes the hip joint could actually dislocate, swelling, bruising, and sometimes the nerves that actually traverse that place could be injured. So you diagnose it from x-rays, you diagnose it from CT scans, also physical examination. The treatment is for non-surgical bed rest, limited weight bearing. They have to actually do some 1 or 2 maybe splintings at the place, and all of that. Then surgery, they can do open reduction or internal fixation for the fractures there. Then sometimes if they see that the healing will not be adequate, they can do a hip replacement surgery for that side.